There's so much going on developmentally with vision, and it is very tied to motor. It's those things are developing in tandem. So when a kid has motor delays, like let's say they have delays in learning how to coordinate, learning to walk, learning to do their fine motor skills, they are at an increased risk of having delayed in vision development. So when we see kids who come in and they've been through speech therapy and they've been through occupational therapy, it's not going to be a big surprise that they have a vision deficit and they need some vision therapy too. Because those things, they just need a little push. They need a little help figuring out how do I develop these skills. There's so much that our eyes do for us that we don't realize. There's all these fine tracking skills our eyes have to have. And that really develops between age 2 and 7.
Today I'm joined by Dr. Leanna Dudley, developmental optometrist and founder of Denver Vision Therapy, a private practice that treats vision, reading, and learning issues, visual processing, and other eye problems. In this episode, Dr. Dudley discusses symptoms of visual problems in children, types of vision skills and how they co-develop with motor and processing, milestones parents and teachers should be aware of, what vision therapy entails, and so much more. This is just part one of my conversation with Dr. Dudley, and I hope you'll tune in for follow-up episodes where we dive into the relationships between vision and dyslexia, ADHD, and autism. Do you want to just start by talking about some of the symptoms of vision problems so that teachers or parents that are listening can kind of think about what they want to look for in the classroom or at home?
Yeah, and I think vision symptoms is where I always start with my patients because, especially with kids, they think that everybody sees the way they do. They don't understand that how they see might be different and they might be working harder than they should have to. So sometimes we can kind of get kids to talk about their vision symptoms. Sometimes when they're 7, 8, 9, I can start to ask questions like, hey, does the print, when it's small, is it hard to see? Do you prefer bigger print? That means it could be blurry, but they don't know the term blurry. So you want to ask in a different way. Another is asking if they see double. They don't know what double looks like, but you can say, do things split into two and come back together? Because even a little bit of double vision is an indication of a pretty significant vision problem. So there's no amount of double that is normal for a person to have. The bar that I always let people know that this is the bar of expectation is that you shouldn't have to think about your eyes at any point during the day. Things should just happen. It should be automatic. And so for kids, they're automatic, their default is whatever they're experiencing. So they might have blur that, their vision goes in and out of focus. That's something you can ask about. They might have skipping words or lines with reading. That's something that you can definitely ask about, but won't become apparent till they start to read, right? So at that point, they're already struggling. Whereas if we test these things, we can tell when they have a tracking issue. Headaches is another one. A big indicator of a vision problem is headaches. Headaches aren't normal in kids. And so we really look at if we see a vision problem and the kid's determined to keep at their task, then they can cause headaches, eye strain. But some kids don't report any of that. Some kids will say everything's fine, but you'll see the behaviors. You'll see them avoid. You'll see them distract. You'll see them act out. And so that's why there's, historically, what I do has been called behavioral optometry because we're looking at the behavior of the kid. And so I think for teachers, they can look at what kind of behaviors come up specifically when we're asking someone to do a near task, to do reading, to do writing, something that may be difficult for them and they're finding a way out. So looking at behaviors is another important one. Avoidance. The other things are their posture. Are they getting too close to their reading material? Are they putting their head on the desk? Are they covering an eye? A person should never have to cover an eye to see better. That's a huge red flag. So looking for head turns, head tilts, unusual postures and positions that kids may take to try to get their eyes to work together is another observable sign. But some of these aren't really detectable in kids who are little, mostly kids who are school age.
So it sounds like there's different levels of, you can talk with the child, get them to maybe report some symptoms. You can look for some of these different things like head tilting, squinting, closing one eye, maybe are tracking with their fingers as they're reading, losing their place, that kind of stuff. But then you also mentioned the behavior problems that could maybe look like something else, but it's actually caused by vision.
Yes, exactly. Because every kid, like I'll list all these symptoms, but most kids don't have all of the symptoms. Some do, but for some kids, they might just have a couple of things. Some kids might not report anything. It really depends on how their nervous system is responding to the problem. And as we know, kids' nervous systems really vary in a wide range. So some kids aren't going to report any issue, but when we look at their reading or we look at their performance, we can see, okay, there's something going on here that isn't connecting visually. They're skipping words when they read out loud. That's sometimes the only clue. And I think that one of the things that I've found really helpful is everybody who comes to my office starts off with a vision symptom checklist. It's actually on our website. It's available on denvervt.com, going to resources and then patient forms. And there's a child checklist and an adult checklist for vision symptoms. I based the child checklist off of the symptoms that came from a study, but I added a lot of questions because that study was shown to be limited and not detecting some different types of conditions. And so I really wanted to see what is the kid experiencing with regards to vision symptoms, but also reading symptoms and writing problems and sports performance. And are they running into things, so I can get, once I see that symptom checklist, I get a really complete picture. And for ease of parents using it, there's a score and you can score it and then you can see where things land with the kiddo. So that's another helpful tool.
There's so many paths that I want to go down on this. We're going to get into a bit of this, but for a parent who is noticing some of these signs and they go to your website, they can complete this checklist and the scores indicate that, yeah, there might be something going on. I don't want to get ahead of our conversation, but is this a good place to talk about what they should do next? Like who they should talk to, or
Sure.
what does a parent
Like
do
kind
if
of
they're listening?
the flow of things from there. So the symptom checklist is a really good place to start. If you're finding that something is coming up as a yellow flag or a red flag on there, either you can call our office or the symptom checklist does get submitted to our office and they can reach out if that symptom checklist is looking high. And our staff, I tell you, they are incredible at chatting with patients on the phone, taking those intake phone calls and discussing and teasing out, does this sound like a vision problem or not? They'll take in a lot of detailed information and, what the patient's issues are and say, yes, this does sound like a case that could benefit from our services. And if they're not sure, I will say, like, the things that we don't see, the things that aren't cases for us, is if it's a retinal problem. Now, this isn't common in kids, but for folks who have macular degeneration or glaucoma, they are weeding those patients out and they need something different. If they're not sure, they ask me and we discuss it. So we really try to make sure anybody who is on our schedule needs to be on our schedule, and we don't want to see the patients who might need something else. So they do a good job with that.
Okay, good to know. Do you want to talk a little bit about vision vision development and how it fits in with the overall child development milestones?
Yeah, absolutely. Because I think importantly, there's so much attention on motor development, and we can see that development happening. We watch a kid start to walk, start to grasp things with their pincher fingers. We can see all these milestones that we check off. But at the same time, vision is developing in some very, very important ways, but we can't see them as much of what's going on. So, for example, around age 2 or 3, kids start to focus differently. They start to focus on details more. This is why there's a whole subset of eye turns that come up around age 2 or 3. There'll be an eye that turns in when they're focusing hard on things, or an eye that turns out because they can't align their eyes well enough at the distance. So there's all kinds of things that come up around age 2 or 3 that are really important to address right away, because eye turns can have, some consequences on depth perception and quality of vision in one eye. And so there's so much going on developmentally with vision, and it is very tied to motor. Those things are developing in tandem. So when a kid has motor delays, like let's say they have delays in learning how to coordinate, learning to walk, learning to do their fine motor skills, they are at an increased risk of having delayed in vision development. So when we see kids who come in and they've been through speech therapy and they've been through occupational therapy, it's not going to be a big surprise that they have a vision deficit and they need some vision therapy too. Because those things, they just need a little push. They need a little help figuring out, how do I develop these skills? There's so much that our eyes do for us that we don't realize. There's all these fine tracking skills our eyes have to have. And that really develops between age 2 and 7. And that ability to track well is how we pick up details. It's how we can find things. It's how we make sense of the world around us. So these skills that kids need are still in the process of developing by the time they're in kindergarten. So when kids enter kindergarten, they're still learning how to track with their small eye movements. They're still learning how to do the skills they need for reading. They're usually not there yet. And certainly there's a subset of kids who figure it out and their vision develops normally. But because reading is pushed so early, it used to be 7. And honestly, the vision skills for most kids, 7 is when those skills are really ready for reading. 5 is pretty early. And some kids figure it out and some kids don't. But what happens developmentally when you have a gap and there's something you're being asked to do and you can't do it, and that gap is big enough that you can't figure out how to make that leap, you end up stagnant. You end up stalling out with their vision skills. So you may see kids who just don't even, they kind of go worse because they're stuck. And so these are the kids who will end up tracking by moving their head. They are using their neck muscles to control their head instead of using their eye muscles. And it's a very inefficient thing to do. But once they say, okay, this is my compensating strategy, they kind of get stuck that way sometimes. And that's how, we see kids who are 8, 9, 10 who are still moving their head when we're there tracking.
So these developmental milestones, for anybody who doesn't know, maybe listening, these are all based on age.
Mm-hmm.
So compared to their same age peers, how
Mm-hmm.
these skills develop. What do you see in terms of relation to maybe interests or cognitive abilities, or like with gifted learners? Is there any kind of difference? So if they're still developing their eye vision skills based on age, but maybe their interests and abilities are advanced, how do you see
Oh,
that discrepancy?
yeah. So it really depends on the kid. So some kids who are gifted and talented, where everything is trucking along for them developmentally, I see that their vision skills are higher. Like those first graders who are reading chapter books. Like if everything's going well, their tracking is above normal, and that's fantastic because it needs to be to keep up with their brain. But when I see kids, and I will tell you, it's particularly the kids who are farsighted and or have astigmatism. So these kids who need a prescription early on, they are at a higher risk of having challenges. So I've seen many kids who are gifted and they will often really struggle. They'll still read, but they really struggle with it. And they might only do average in the classroom. And so they're completely under the radar of the teacher because they're keeping up just fine, but their potential's so high, they're being held back by their vision skills. And then once I've had a couple now where we've got them in vision therapy, and once they get done, they have to switch schools because now they're in a GT program because they can fulfill their potential, which is really fun to see. But those high prescriptions, they do set kids up for having challenges with vision development, and it's often missed. So
Yeah, I would imagine. Yeah, we do see kids like that from time to time. And what you just said, that regardless what their abilities or interests or skill levels are, if they're having these vision problems, they're performing down here, maybe average or below average. And then once those are addressed, they shoot up and move closer to their potential. That's so cool.
yeah, it's so cool.
So that's a little bit of an overview of vision development as it relates to other skill development and age. And you pointed out something that I just wanted to revisit, which we talked earlier about symptoms, characteristics, signs of a vision problem. What I think I heard you say is that if they've been in other therapies, if there's other things going
Mm-hmm.
on, that may be an indication that, yeah, we probably want
Yes.
to get vision checked as well.
Yes, and I certainly am not saying every single kid who needs one needs the other, but it's worth an assessment. It's worth taking a look to make sure there's not another issue. because it's just playing the odds, really. It's just there's a higher risk. There's higher risk for these functional vision problems in a lot of different groups, which I know we're going to talk about some other ones. But any kid who has any delays in development, whether it's prematurity, reduced APGAR scores, any kind of genetic differences, any developmental delays, those are all going to have an increased risk for vision issues. And so I work with all kinds of patients with all kinds of different needs. I find it to be very fun to work with people who have unique challenges, and the exam just looks different every time. And so they are a lot of fun. And some people will think, oh, you can't possibly test my kid. He can't, say what's on the chart yet. Doesn't matter. It doesn't matter. I can get all the data I need with objective testing, and they are so much fun.
That's so cool. Yeah, I believe you.
Yeah.
I believe you 100%
Yeah.
with that. Yeah, somebody who's skilled like you can go in and really pull out that information that may not be so obvious or easy for somebody else to do. I have two questions that come to mind listening to you, and take whatever question in whatever order you like.
Mm-hmm.
I'm curious what the different vision skills are. I know there's different components or
Mm-hmm.
different types of vision skills. But I also wanted to know what you would recommend for parents who are concerned about vision problems, and like what the different kinds of vision tests and screens look like in schools and at the various optometrists and at wellness visits. And so I don't know which order you want to take those, but
Yeah, there's definitely a lot to cover there. So let's start with what vision skills are. Like, what am I even testing? And so let's start with that, because that's like the foundation for a lot of my tests and a lot of our therapy. So the skills that kids need to be able to perform everything, we got tracking, how well the eyes can move from one thing to another. We got eye focusing. So there is like a camera lens inside the eye that has to adjust. It adjusts so fast when we change distances that we never see blur. That's how it should function. We also have eye teaming skills, which are how well the eyes work together as a team. This means that two eyes point at the same place to give us single vision, right? Because if one eye is not pointing at the same place as the other, we have double vision. Double vision is terrible. It derails everything that you're trying to do. So no double vision, please. We also have, under eye teaming, we have that development of depth perception. So understanding where things are in space, which is one of the amazing things about our visual system. We have so much information about the z-axis in front of us when we have good depth perception. And when kids don't, when their depth perception is unstable, we see that come up not only in sports and everyday stuff, but also in reading, because it makes that task harder as well. So those are the visual efficiency skills. So that's how your eyes move and focus and change to be able to get information from the world into your brain. So once you have the information into your brain, then it has to be processed. And the visual processing happens in just about every lobe of the brain. It goes from the back, the occipital lobe, and then a lot of the processing happens in the temporal and the parietal lobe, which are just vision processing everywhere. So you have to be able to make sense of what you're seeing in order for that to be useful information. Otherwise, you're not using your vision to its fullest extent. So vision processing are things like being able to remember what you see, being able to discern the details, being able to tell the difference between letters and their orientation, so B's and D's. These are all under the umbrella of vision processing, and there's a lot of different subsets of skills in there. We test for all of those, and we can work on those, because what happens is if you have trouble with visual efficiency skills, you can't get the information into your brain, then you're going to have trouble figuring out what to do with it. It's like garbage in, garbage out. So oftentimes when a kid we're working on a whole case, we'll start with the visual efficiency skills and then really work up to reteaching them how to do the vision processing and how to really discern the shapes and the things and the forms. And we have all kinds of puzzles and games. It's really fun stuff. But that helps bring them up to speed on visual processing. And one other piece on visual processing, I think that there's often a view that kids just have different learning styles. Right? So, my kid's more of an auditory learner. And then there's some kids who are more visual learners, and there's kinesthetic learners. Well, what it turns out that, our school system is set up to really introduce the information visually most of the time, with an increase in visual learning as they get older and by the middle of elementary school. You better have really good visual skills for learning. Otherwise, you're going to be falling behind, because auditory learning is just not as efficient. You can't retain as much information. The picture is worth 1,000 words. So I think that what I see is a lot of kids who come in, not, it's not as popular lately to talk about learning styles, but I do see some kids, oh, they're just an auditory learner. Well, that's because they have vision problems. They have developed this compensating strategy of relying on their auditory skills, not relying on their visual skills, not believing what their eyes tell them because it's not reliable. And so then we have to undo that. We want to keep their strong auditory skills. We really need to teach them to rely on their vision so that they can become more efficient learners, because that is how you become successful in the traditional sense, at least academically in school.
Going back to our discussion of development, something I forgot to ask, and you just made me think of this. Is there a time when your capacity to develop these vision skills ends or drops off? I mean, is it like as you get into adulthood, is it harder to regain or develop these skills, or can this be done throughout the lifespan?
So first answer, absolutely can be done throughout the lifespan. We can see, and it's because, like I said, so much of vision processing is in the gray matter of the brain. We know that the gray matter has so much more neuroplasticity when compared to, the more basal structures like vestibular, it's really hardwired. There is a lot of plasticity in the visual system throughout life. Now, that said, I would prefer an 8-year-old than a 14-year-old because you are going to see more plasticity and more changes. I think it's not so much that there's more changes, that's true, but also you're not having to spend as much time with a younger kid undoing bad habits. So they develop compensating strategies that become more ingrained the longer they have them. And then you have to undo those compensating strategies and then retrain how you want them to work. And then you have a kid who's 10 or older. Now you also have to show them and hope that they see that they can be a good reader, that they can do this and like it, but you have the mindset and you have the view of who they are as a person, who they might say, I'm just not good at reading. I'm a sports person, but when you have a 7, 8-year-old, they are just putty in your hands. You can take them to different directions with how they think about themselves. And I think it's just, that's why, earlier the better. I think we're going to talk about screenings here next, but I really wish that all kids could have a really good eye exam before kindergarten, because if we had kindergarten screenings before kindergarten, had every kid who had glasses that they needed to, if they needed glasses, and then did some vision developmental activities in kindergarten, they would save the school so much money. Like, it would save so much money on intervention and remediation. And anyway, but that's really just a pipe dream. I think that that's a great age. 5, 6, 7 is the age where we really detect a lot of these issues.
So start as young as possible. Younger is better. It's not a
Mm-hmm.
lost cause once you get
Not
older,
a lost
but
cause. We have so many patients who are teenagers. Often the teenagers come in more severe because they're like the last one just yesterday, constant double vision, because things have deteriorated so far. Now they're like, all right, I do need to get this addressed. And adults are the same way. They will wait till things get really bad before they come in. But half of my patients are adults. We see adults all the time and really incredible changes. So it's never too late to work on this stuff, as long as the patient is willing. That's the thing with the teenagers. But I can get them on board most of the time.
that's the
Usually
case with.
I like to try to just speak directly to the teenagers and really what is it that motivates them? What is it that they want? And try to align what we're doing with that.
Let me throw in kind of a question that just popped into my head. Do you find that there are certain activities or styles of learning in the classroom that promote vision and visual processing development versus, because as you're talking about things like eye tracking, eye focusing, eye teaming, I work on a computer all day and I know it's
Yeah.
not good for my vision because it's just this static, distance and I'm not. So are there certain activities that, and maybe this is a different discussion, but are there certain things that happen in the classroom that you feel like just very generally are really good, even for taking eye breaks or changing things up?
Yeah, and I think that you're right. Screens, and I'm just going to talk about screens for a moment because we talk about that with almost every single patient. The reason screens are so straining is because our eyes and our depth perception that we have is really meant for appreciating 3D objects. So when you look at a cup, you have depth. A screen is flat. So it gives our eyes less information. We have to constantly realign our eyes, like where is it in space? Where is it in space? Because we don't have a good understanding. Our vision doesn't have a good understanding of where it is in space. So it's additionally straining to focus on that screen. Also, it's a light source, and that's just adding to it. So yes, screens, and we talk about this with parents, that screens are something, it's like ice cream. You wanna, not, I'm not saying none ever, but we have to be really mindful about the age and the development of the kid and go slow to increase our screen time. So in school, certainly, the most schools, at least out here, they check out is, I think they're using the iPads or a Chromebook starting in kindergarten. And short bursts aren't going to be the end of the world, but I do see the kids who are on screens more in school at a younger age that can make it more difficult. Kids at that age, when they're 5, 6, 7, really need hands-on experiences. So the schools that have more, and there's some approaches that are just different than others, will have more opportunity for hands-on learning, more opportunity for breaks. Outside play is so important. And the other thing besides just screens is paperwork and worksheets. So the schools that have a increase in workload, that have a more worksheet-based kind of learning, that sets kids up for challenges who may not have the vision skills to meet those demands. So that's some things, and it varies from school to school. But I think that what parents can do outside, because I've put my kids in public school, and I go through the challenges all the time with that, and I just try to make sure that I structure their habits at home with screens in a very healthy way. Try to have a lot of hands-on toys, have a lot of interactive activities for them, to help their vision development. And we often will see vision processing games or some visual memory games. Those kinds of games that kind of sneak learning in are another good way to kind of supplement their vision growth.
That totally makes sense. And you talked earlier about the correlationship between vision and motor skills. I mean, they develop
Mm-hmm.
together. And so
Yeah.
getting outside, playing with the ball, doing hands-on activities. I'm reminded of the diagram of how children learn and the size of their body parts based on how they learn, and their hands are huge because they
Yeah.
learn so much with their
In the
hands. So
prefrontal cortex. Yeah, I
yeah.
think that's so cool. I wonder how that looks with how much we use our phones now with our thumbs. um, And I think that the biggest risk with screens is that what it's doing is replacing time that kids should be doing those activities. And certainly there's some kids who avoid things, like if they're sensory avoidant, you're going to have more issues with that. So screens are they're making it easy. Screens are meant to be addictive. And so it's our job to really make sure that they're only using it in a healthy way. And so as long as there's some kind of guidelines there for them, that is great. So it changes by age, but just keeping it in moderation is the best way to go. And it's the habits that make the difference, not the one time you take a trip and you hand your kid a tablet on the plane. That's not going to ruin their eyes. It's every single day having unchecked screen time that will, in fact, have long-lasting consequences.
Well, do you want to take some time and talk about vision screenings and testing and what is normal? How does that go in childhood, and what should parents be pursuing in terms of understanding their child's vision?
Yeah, absolutely. So we know that kids have vision screenings, and that word screenings is important. We're going to talk about that. So they have vision screenings at the pediatrician office and at school. And what that consists of is reading a distance chart with one eye and with the other eye. Typically, that is it. That is the start and the end of the vision screening. And yes, this is important to find those patients who can't see in the distance. You are catching patients who are nearsighted and can't see the board. Very important. You are catching kids who have a lazy eye, which is called amblyopia, who can't see as well out of one eye, and they may need a prescription in one eye where the other eye is fine. So those are important things, but I will say that they miss all of the kids who are struggling with reading most of the time, because there is farsighted vision, and farsighted vision is when you can work to see far, so you can make it clear, but that is work, and near is more work. There is no testing done for near with these screenings, none. So you're missing the kids who have a higher risk of having reading challenges, because kids with the farsighted prescription, studies show are at more risk of being delayed in their reading. You're also missing, of course, the kids with convergence problems, the kids with that, which I guess a type of eye teaming problem. You're missing the tracking problems. They often also miss even moderate prescriptions, maybe sometimes even a high prescription, because what the kids will do, and they'll tell me, I've had kids in my chair tell me, oh yeah, I just covered my bad eye and read the line. And then I covered my good eye and just repeated the line, even though I couldn't see it. So it's very easy for these kids to peek and not really be truthful on the test. They're just doing their best. They're like, well, I figured it out.
As a
So
parent, I know from personal experience exactly what you're talking about.
yeah. So I think that the while the screenings are important, yes, the harmful part is that it gives parents a false sense of security. Parents feel like, well, vision's been checked. We can check that box off. It's not vision, where it really then they start looking other places without really exploring what else could be going on with vision. So, okay, so then let's talk about what is the difference between different types of eye doctors. All right, because what happens is if the pediatrician has an issue, they will usually refer to a pediatric ophthalmologist. They might refer to an optometrist, but an ophthalmologist is somebody who has gone through a very different route than I have for training, and that's very important. They do surgeries. So they're sending these kids with these prescriptions that might be, it's not just need that they need glasses or they need some kind of therapy. They're sending them to somebody whose specialty is surgery. And this always baffles me, but it's because they both went to the same school. They both went to medical school, and they try to keep things in the same bucket, so to speak. So optometrists go to optometry school. So we spend that whole time, instead of learning about the entire body, we spend the whole time learning about the visual system. And then, people who do what I do specialize in children's vision, concussions, and all of that, and do extra training to do that. So there's optometrists who just do primary care, and they are good at glasses, contacts. They may or may not catch these problems. I gotta be honest, I have my wonderful referring doctors who know how to screen, they know how to send them, and they understand that they don't have all the answers, they need to send to somebody else. And then I have some optometrists who just do the basics. They just check for prescription. If there's no prescription and the kid's 20/20, they say they're fine. But they haven't done the simple screening tasks that they can do in an exam to send the patient where they need to go. So that's kind of hit or miss with optometry. With ophthalmology, the pediatric ophthalmologists, they rarely do those kinds of screening tests. Their prescribing philosophy is very different. It's very outdated, and there's not going to be the same kind of openness to even doing the screenings to check. Now, of course, there's rare exceptions, but on the whole, that's what I've found.
What kind of advice or checklist or sort of developmental milestones would you give to parents in terms of, okay, here's when you need to get checked, here's when you need to reach out to an optometrist? I know you provided some information about the questionnaire on your website, so anybody who's listening to this, any parent can go to that website and put that on. But are there other times in a child's life, or do you just recommend going to an optometrist no matter what the school says, or what are your thoughts around that?
Well, there are some states and definitely some other countries where they require a complete eye exam before starting kindergarten. And if that was a state, decree, that would be amazing because we catch a lot of things. But I think that the American Optometric Association, what they recommend is having an eye exam at age 1, 3, and 5. And that's just easy to remember. So you want to make sure nothing major going on at 1. And give me a 9-month-old instead of an 18-month-old any day. I love the babies. They're easy. It's a piece of cake. 2, 3-year-olds, we work hard. We get it done, and it's a lot of fun, but it's a lot of tricks. But the thing is at 2 and 3, remember, there's a lot of things that can come up with eye turns, with a lot of prescriptions will present. So it's really important to make sure there's nothing major going on there. Yes, we can screen for developmental tracking skills and things like that, but they have to usually be pretty far below for that to be evident at that time. The 5-year-old exam, now that's a fun one because now we're going, okay, are you ready for kindergarten? Do you have the skills you need for kindergarten? And that's where we get to really see what is going to be an issue or not. We have a better idea of if they're going to outgrow it or not, and see what's going on developmentally with their visual efficiency skills. So typically they say every 2 years, but the 5-year-old one, if you had to pick one, I would give me that pre-kindergarten eye exam to make sure everything's good. Now, who you take them to also matters. Certainly, there's some optometrists who do a better job with kids than others. And so you want to ask around, see who the optometrist is who might do better with kids in your area, or just go straight to a developmental optometrist if possible.
That's super helpful. 5 years old is if there's one age to do it, it's 5.
Yeah.
And try to go to a developmental optometrist.
Yeah.
What is the next step? Because I know your practice specializes in vision therapy. Do you want to go ahead and talk about that now?
Sure. Yeah. What does that whole process look like? And that's what people really want when they call in, like, what are we talking about here? So we do a very thorough initial assessment. For kids who are school age, it's 2 hours. For kids who are younger than are not yet in kindergarten, it's 1 hour. And we look at all of these skills and we put it together in a report, go over that report with the parents. Usually it's remote over Zoom, but we can have them come in person too. And really, because I think that we can only go as far as we know we're going to be at the beginning. So we need to really state at the outset what is going on and have everyone have a really full understanding of what the issues are. So that's why I really like to sit down at the consult, let parent ask any other questions that they can, bring in all the parents that are involved. And then from that point, we make a treatment plan, and we figure out what the patient needs to schedule and then get going. So what the vision therapy looks like is we've taken that kid's challenges and we said, okay, we're going to work on these areas for that child. And we develop a customized program with activities for that kiddo. And typically they will do a vision therapy session once a week with the vision therapist. And I have the most incredible team of vision therapists. They are amazing. And so they will take that plan, but they also modify as they see fit. So we want the kids to be doing these activities. We keep it fun. We keep it moving, but they do need to do some home activities. So the in-office session is about having some fun in the office, doing some vision games in the office, but also teaching the parent and the kid how to do those home activities. So we aim to have the activity be hard enough that we're building skills, but easy enough that it's not a barrier. It's 80 to 90% of accuracy on the activity is where we have the sweet spot for the brain making the changes and adaptations to learn how to do that differently. So the kid will do the activities at home, 4, 5, 6 days a week. More the better. Of course, repetition is what the brain loves the most for changes. And then every 10 sessions, which usually is every 10 weeks, I do a progress check. Now, not everybody practices a little differently, but I have a graph that I like to use to show where those skills are at. All these tests have norms and standard deviations. So at the outset, I have a graph that shows what the patient's abilities are. And then at the progress check is where we get to see the next bars on the graph. And then we see how much improvement they've made, and the kids really get it, and they really get excited to see their improvements on the graph. That helps us too to predict how much longer they might need in therapy and which areas we need to focus on the most. So we just continue on. And what we want to see is that kid finishes their program, because we're not just building splinter skills. We're trying to build habits. We're trying to build skills that happen automatically so that the kid does it without thinking about it. And it's not like, okay, don't move your head. Like, that's not realistic. We need that to happen automatically. So we continue to build those skills in therapy, load the activities, add distraction. Now you're balancing on one foot. Now you're reading a chart while you're walking on a balance beam, and there's Mars and balls flying back and forth. And so then doing that, we've integrated those skills and made them occur automatically for the kiddo so that when they leave, they're done. They're like developmentally back on track. And hopefully they'll continue to develop more skills going forward because we've closed the gap. So that's the goal for kids who are coming in for developmental vision therapy. There's post-concussion, there's eye turns, and those can vary a little bit in how much maintenance they may need. But that's generally the structure, what it looks like.
The program sounds awesome. I want to do that. I think that would benefit
It's
everybody.
really fun. They have a lot of fun coming in, and kids really have no problem coming in. Definitely the home activities is where we have to like, okay, we're going to do this thing, and we're pushing on what's difficult sometimes. So we try to change up the activities often to make sure that they can stay engaged.
Is there a typical amount of time that a program lasts, or is it all just child and issue specific?
It is variable based on the kiddo, but I'd say most cases are going to take between 6 to 9 months. There's some cases that take 12 when we have more significant issues. And there's some cases where it is a little more brief. I do try to estimate at the outset how much that kid will need. And I always try to make sure it's a realistic estimate. I'm not undercutting how much they might need. But then as they go through their progress checks, I'm looking for when they're mastering certain skills. So when they master the high level skills and the high level activities we want them to master, they're done. They graduate. And if that happens sooner than I initially said, fantastic. We want them to graduate as soon as possible so that they can use those skills to catch up with reading if they need to catch up, because that is sometimes necessary. We got their vision back online, but now you need some reading tutoring to catch back up with reading. So it's not always, for some kids, it's immediate that they feel the benefits and they're like, oh my gosh, everything just boom, 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 and we're great and we're caught up. But for other kids, they need that remediation time and that time to reintegrate and kind of learn what they've missed.
You mentioned light therapy earlier.
Mm-hmm.
Can you just quickly touch on what that is? And I imagine that's a component of the vision therapy that you do. That's not everything because you described all these other
Right.
approaches as well.
Yeah, so light therapy is a really powerful tool. And what we've found is that by incorporating light therapy, either at the beginning of the program or at the very outset of the program in some way, we find we have better success in the vision therapy room. So we just basically look at each case and decide, but 80 to 90% of cases, I'm recommending light therapy in addition to vision therapy. Now, light therapy is nice because it's very passive. You're looking at a lamp, and this is a lamp that we provide as part of the program. And the colors that you'll need is a specific protocol designed for that patient. But how it's working, it's so cool because it's working on the subconscious autonomic nervous system. And if you think about how I said before about that you should never think about your eyes, that's because the autonomic nervous system is controlling everything, or it should control everything. You don't think about focus, team, it all is happening automatically. And so the light therapy helps to boost the needs of the autonomic nervous system so that it can control the vision system better. For example, I have some kids who are fatiguing quickly. So they might get eye strain. They only can read for 5 or 10 minutes. So we use a protocol for them if it tests out that that's what they need, where it helps to improve their eyes' ability to align and focus up close. And then we see some kids will have significant improvements with the light therapy alone. Other kids might have headaches, and they might have some, also post-concussion is a huge need for light therapy. And so headaches and outward eye posture, difficulties with convergence needs a different color. And we test for that. If it looks like it works, we use that for the light therapy. And then we can see improvement in the headaches, improvement in the convergence. And it all happens without the kid having to exert any effort. All they do is look at a light for 20 minutes a day. And it's doing the work for them because it's helping to address those underlying issues.
That's so cool.
It's
That's
really
really
cool.
neat. Okay, for listeners who may not be in the Denver area or even in Colorado, what are some resources that they can tap into to either get some support or just learn more about this?
Yeah, absolutely. So there's an organization called OVDRA, and that stands for Optometric Vision Development and Rehabilitation Association. And so the website is ovdra.org. And there's a ton of resources on this website. I'm very involved in this organization, and they do have a find a doctor somewhere on there. There's a find a doctor button, and you can put in your, zip code and the proximity, and it'll give you a list of people who provide these services in your area. Now, if you have a long list, certainly that can be overwhelming. You want to look for somebody who is a fellow of the organization. So they're going to have the additional letters after their name that are FOVDR. And that means that they went through the fellowship process and certification process for vision development and vision rehabilitation, which vision rehabilitation usually is in regards to concussion recovery and adult therapy. So that's one organization that'll have a lot of information as well as resources on where to find somebody. And also, I find that there's a lot of good patient-facing information on optometrist.org. They have a section for success stories. So we have a section for success stories too, but if you want to see other people's success stories, you can go there, and they're so fun to read. I feel like that's one of the best ways that parents can really resonate with what somebody else went through, and they might hear something in that story that is similar to what they're going through, and it's a really helpful tool.
All right. For listeners who want to connect with your practice, Denver Vision Therapy, or with you, or to find out more about your services, where can they find you?
So probably the best place is at our website, which is denvervt.com. And we do try to have a lot of information on there. I really love to educate. So we've put a lot of articles on there about different vision problems. There's the symptom survey, there's research articles, there's a lot of resources there. And you can also text our office, which is a cool feature, or you can just contact us on the contact us form. And the front desk, really, we try to keep up really well with that, getting back to people quickly.
It's been a pleasure talking with you. Thank you so much for coming on. And I know we're going to do some follow-up videos that get into vision and autism and vision and ADHD and the overlap between vision and dyslexia. So anybody who's listening to this should stay tuned for that. We'll have that up soon. Thank you so much.
You're welcome. Thanks for having me.
That's it from us today. As always, you can find more information as well as resources on our website, individualmatters.org. We hope you'll join us at the next podcast, where we'll continue to explore topics around successful living, learning and education, and child development, and share ways to help you live a more positive and fulfilling life.
The preceding information is not intended to provide or serve as medical, clinical, or educational advice. Individual Matters is not responsible for the accuracy of guest statements. All information should be validated independently. Please consult with your doctor, mental health provider, attorney, or other appropriate professionals before making any personal decisions for yourself or those in your care.